Good evening. My name is Linda Jackson, and I have NMOSD, which you're going to hear a little bit about tonight, I guess. Mine came on very quickly. In July of 2020, we took a trip to Illinois, which is very flat. And so I walked. We were there 12 days. I walked every day, 45 minutes to an hour. In August of 2020, my daycare that I was directing, preschool, opened in the middle of COVID. We decided to open anyway. In September, I started catching my foot especially on carpets as I walked, and finally decided to go to the neurologist that my primary physician had recommended months earlier. And he diagnosed me with drop foot, sent me to a place to get a brace, and that helped a lot. But I did fall at least once in September. October is the month that just was a whirlwind for us. The first weekend in October, I was at the zoo for an educators event, walked around the zoo for a couple hours that evening. The next week was good. I started having to use a cane and a walker sometimes. But that next Friday, I went to a doctor's appointment, got the walker in the car by myself, and drove home. The following Monday, I had a lumbar puncture scheduled. My doctor's still trying to diagnose what exactly was wrong with me. When we got home from the lumbar puncture, I could not get back up the stairs. We have 2 sets of stairs from our garage in the house we had at that point. Could not get back up the stairs. Once we got me up, I was able to use a walker on Tuesday. Wednesday, my husband put me in a wheelchair. Wednesday and Thursday in the wheelchair. Thursday evening, doing a transfer from the chair to somewhere, my good leg spasmed and went out, kind of hurt his back. And at that point, Friday morning, we called my doctor, and he had told us if we ever got to the point where one of us felt like it wasn't safe for me to be at home, to call him. And so I spent a week in Wellstar Paulding Hospital, spent 2 weeks in rehab. I chose a rehab in Noonan, and we live in Dallas in Paulding County, but it was COVID and nobody could have visit. I didn't have a single visitor in the hospital. I expected the same in rehab. It turns out he was able to come 2 days a week for a couple hours a day. So he brought me changes of clothes and took clothes home to do the laundry, but had a really good experience there. But it's an acute rehab. So they sent me home after 2 weeks, got home. I was home for Thanksgiving. The weekend after Thanksgiving, I had a second attack, just 6 weeks after my first one. And that sent me back to the hospital. This time I went to Emory on the advice of a friend. She said, just go get a second opinion. So I went to Emory. I was diagnosed at Emory. Last Sunday was the 4th anniversary of my diagnosis with NMOSD, aquaporn 4 negative, positive. He knows that stuff better than I do. And so spent 2 weeks there at Emory, got a plasma exchange, and they started me on the medicine called Rituxan, an infusion that I get every 6 months, and sent me home on December 30th. So all of that happened in the last 2.5 months of 2020. Like I said, in the middle of COVID, it was scary. I was all by myself. I had to figure out how to speak up for myself, which is not something I spent the first 60 years of my life doing. But I learned how to do that pretty quickly. And so they sent, they sent me home at the end of December of 2020. Life had changed just unimaginably. And we were kind of stuck trying to figure out what to do. So they sent me PT and OT for almost a year. At the end of 2021, they decided that I would be probably better served by going out for physical and occupational therapy. That lasted 12 weeks, and I got discharged because that old, you're not making any progress, so the insurance won't pay for it thing. So then we were on our own, and we had to figure out how to manage this, not knowing what it was going to, turn into. All the reports we heard was that it was a permanent thing. So had to figure out what we were going to do then. So we began to learn what we needed to do. I am very blessed to have a husband who's an engineer, and he started looking for things we could buy or things he could fashion. We got a stair lift, and had to have a hospital bed before they brought me home in December. We got he got a lift for getting me in and out of the car. We got a wooden bench so I could slide in and out of the shower. He took the door and the front glass panel off the shower and rigged up a shower curtain so that he could help me. I have gotten stronger since the very beginning, but at the same time, I've also gotten not weaker, but my legs and my hips especially are getting stiffer. So it's sometimes it's very hard for me to help him. But when the wooden bench didn't work, we got a chair for the shower that has a sliding piece that slides me in and out. We moved in September to a 1-level house, so the stairs are gone, and that is wonderful. But it created just took a probably, I don't know, 3 weeks to a month to readjust to the new surroundings. Silly things like I was in the shower facing the opposite direction that I'd been in before. So had to get used to it. It seems silly, but it was, just threw me off for a little bit. We looked into getting a wheelchair accessible van. My husband took a test drive in one, and he said he didn't like the way it, because all the insulation is out of the bottom. He didn't like the way it sounded on the road. So we got a regular van, and he got a new lift to put me in that van that is specific to our van. We have 2 packing strips that he attached to the end of my bed so I can use them to help me pull up. Just all kinds of accommodations that we figured out. And it's a continuous learning process. It's not the life we planned on. We had to grieve that a little bit, but I try to stay positive every day. I think I would slide too fast downhill if I didn't stay positive and just be thankful for what I have. Thank you.
Hi, everybody. My name is Amber, and I also have NMOSD. I just wanted to give a shout out to the founder of the MS News and Views, Stuart Schlossman. And I'd like to give a shout out to you guys too in the audience, everyone who made the sacrifice to be here this evening and to join us on Zoom. Your efforts are not overlooked because I know it wasn't easy. And I pray you make it home safely tonight. You matter. Your pain matters. Your suffering matters. Your tears matter. Your life has value. Not just some of us, and not just most of us, all of us. And just so you know, some of this is kind of like audience participation, okay? So somebody say, all of us. Say, all of us.
All of us.
See, you're not alone. Say, I'm not alone.
I'm not alone.
I am not alone.
I am not alone.
Yeah. Thank you. Because that sounds beautiful. I mean, let it ring up in here, okay? Because it's a joyful noise. One of the first things I lost when I received my diagnosis of NMO was I lost my purpose. I come from a very hardworking family. My mother and my father instilled that work ethic into me, my mom, at a young age. And by the way, I'm a Georgia girl. I'm a true peach. I'm from Decatur, Georgia. Do we have anybody else from Georgia in here? Let me see. Okay, see, I knew it was gonna represent. Yes, ma'am. I started working at 15. So when I found out I couldn't work anymore, I lost my independence. I felt ashamed. I felt abandoned, worthless. I actually felt lazy, which is something I've never been. I couldn't do much, so in my mind, that meant I wasn't worth much. It wasn't my fault. I had grown accustomed to doing things a certain way my whole life. My mind was literally programmed a certain way. And so when my body failed me, my mind started trying to run the show. And then it took years of self-torment and falling down and bumps and bruises for me to realize my mind don't run nothing. Baby, the mind is powerful. Your mind could tell you to stand up on that wobbly chair all willy-nilly because you see some dust on the ceiling fan. And oh, that needs to be done right now. And so here you go, trying to do the impossible. I found out the hard way. It don't work like that no more. Because I didn't have anyone to tell me that in illness, it's your body, not your mind, that has the last say so. What do I mean by that? Well, it's the struggle to keep up with what you used to do, what you used to be. How many of y'all have ever heard that saying, out with the old and in with the new? Yeah. Out with the old you and what your life was supposed to look like. Now, that doesn't mean you should keep your ceiling fans dirty. Some of y'all gonna go home saying, well, Miss Amber said, I ain't gotta clean no more. Nope, not saying that. I'm saying there's a better way. There's a safer way. And you can determine what that looks like when you listen to your body. There has to be a customized plan of action for you and you alone. And there are people called occupational therapists who are professionals at finding creative ways to accomplish your everyday task. You know, I find out there's nothing wrong with getting help. There's nothing wrong with saying, I need help. I suffer from mental illness now, severe anxiety and depression. I know that most of the time it feels safer to isolate yourself than to feel judged. It's easier to go to sleep than it is working hard to interact with the world that feels suffocating. This is no time to go into seclusion. Some call it protecting your peace. Have y'all heard of that? Protect your peace. And I get it. Peace of mind is very important. But when you isolate, you do exactly the opposite of what you intend to accomplish. Isolation can put you in positions that are damaging and destructive. As humans, interactions are a part of our DNA. It's in our genetic makeup, and we literally need each other. So, how do you live with a disease that makes it nearly impossible for you to be around people without catching a cold or a flu or COVID? There's a thing called the internet, telephone. Yeah. And listen, people can say what they want about technology, but technology allows someone like me to travel beyond the confines of my room. I can speak here in East Point, Georgia, and be heard and be felt and resonated with clear across the planet by people I've never met before. That's the power of technology. And when I was first diagnosed, there was no Instacart. There was no Uber. There was no Twitch. There was no Kick where you can enjoy live DJs and stream concerts all from the comfort of your bed. There's ways now to find ways to interact. You know, one of the best things I did was join a support group. And some of the members are here from my NMO support group here in Georgia. And nowadays, you can join the meeting virtually or dial into the meeting. You don't have to turn your video on. You don't have to speak at all. Honey, you don't have to move a muscle. Just turn it on, roll over, and listen. Shoot, that's what I do. Because you don't have to be seen to be felt. You're still a part of something. You're supported and thought about and loved and appreciated. And I know it can be hard to keep up with technology. My mom, Lord. But I bet you keep up with those Powerball numbers. And so I asked, what's really holding you back? Technology. You ever get the latest phone that come out? What they call that? An upgrade. They call it an upgrade, right? I had to stop thinking of my life as a downgrade. It's an upgrade because I got up this morning. That is nothing short of remarkable. You ever try to use a new device and power it with an old charger? You ever try that? They don't even make them kind of chargers anymore. The old ones don't even fit into the new device. In fact, the new device comes with all new chargers, don't it? In other words, it's time to let the new you in. Yeah, the new life comes with the new you. You have to let go of what illness looks like. Because look around. This is what it looks like right here, right now. It looks like progress. It looks like strength. It looks like you and me. What would you do if you had an extremely rare diamond in your possession? Today. You move heaven and earth to protect it. I know you would. I heard somebody say they might even swallow it for good measure. Because ain't nobody getting to that. Right? Your life has immeasurable value. But sometimes this world can make you feel like your life isn't important as the next person's. I go out, I have my walker. You should see the looks of disgust I get in some of these places. And I'm like, my walker is pink with leopard print. Okay? My walker eats down. Okay? There ain't no shame in my game. Because I know my creator. And he doesn't make mistakes. Okay? I'm 10 of 10. 10 out of 10. That's what they say these days. I'm 10 out of 10. I'm 1 of 1. I know who I am. And I'm proud of who I am. I've even heard people make comments say, why is she here? I've heard people say, why are you even here? That's hurtful to hear that. But I found out you lose precious time trying to control what someone else does or trying to control how someone else feels. That's time you can never get back. Each second we are alive is a miracle. When I go places, they want to sit me in a corner somewhere because I guess they feel like I'm in the way. But times are changing. Have you noticed that in a lot of places like the airport, the line for needing wheelchairs is longer than the regular line? And that's why there's power in numbers. There's a consensus of facts and a reality that can no longer be ignored. You know, I signed up to speak intending to tell my story of how I was diagnosed in 2012 with NMO and then sarcoidosis. And I've had relapses and then the onset of bronchiectasis and what life has been like dealing with setback after setback. But when I started to write the words, all this other stuff started coming out. And I feel it feels good because my story isn't over. And now you all are a part of my story. You are the leading actors. You are the directors. You are the playwrights, the composers, and the editors. You are the star of my favorite show. And so I'll be coming around getting everybody's autograph after the program. And in closing, I like to say, some people say things like, this is my season. Y'all heard that? But I tell you, more than just one season belongs to you. And as long as you are breathing, this is your time. Every time you smiled on the outside but was broken on the inside. Every time you asked for help and somebody sucked their teeth and rolled their eyes and took their poor sweet time and you still sucked it up and allowed that person to help you, knowing they never let you forget how they helped you. This is your time. There is a space for us as patient advocates now, more so than ever before. And it's because organizations worldwide are listening to us. Because duh, we're the experts. And this is no shade to our healthcare professionals. We love you, okay? But I find patient to patient, we speak the same language. And so I think we could find a way to bridge the gap between doctor and patient, where there isn't a war or a blame game. It's a community. As a matter of fact, you see this woman right here? Yep, you. Protect this woman at all costs. You see that gentleman right there? Protect that man at all costs. We are our responsibilities. And if no one else tells you they care, I care. And I mean that. I care about you. Thank you. Thank you.